Welcome to our video on osteosarcoma and Ewing sarcoma. Here's our overview slide. Let's begin by discussing osteosarcoma. With regards to osteosarcoma, we'll be discussing general features, clinical presentation, diagnosis, and management. So let's begin with some general features. Osteosarcoma is a malignant osteoblast tumor. Primary osteosarcoma is common in males less than 20 years of age. In fact, this is the most common cohort of osteosarcoma patients. Secondary osteosarcoma, on the other hand, is present in elderly people with predisposing factors such as bone infarcts, Paget disease of the bone, or bone radiation. Hereditary osteosarcoma is associated either with Li-Fraumeni syndrome or familial retinoblastoma. Li-Fraumeni syndrome is caused by a TP53 gene mutation. This syndrome is also called SBLA cancer syndrome because it's associated with sarcoma, breast cancer, leukemia, and adrenal gland cancer. Familial retinoblastoma, on the other hand, is caused by an RB1 gene mutation. Mutations of this gene also predisposes patients to osteosarcoma. Moving on, let's talk about the clinical presentation of osteosarcoma. Patients with osteosarcoma present with localized bone pain, an enlarging bone mass most commonly in the distal femoral metaphysis, and pathological fractures. The diagnosis occurs with a bone X-ray, which may reveal Codman triangle and the sunburst pattern of bone. Codman triangle is characterized by elevation of the periosteum by an enlarging bone mass, and the sunburst pattern refers to spiculations perpendicular to the diaphysis consistent with malignant bone proliferation. Here is an image which highlights Codman triangle, we can see that right here, as well as the sunburst pattern, which we can see right here. Management of osteosarcoma may include both surgery and chemotherapy depending on the stage of the tumor. It's worth mentioning that primary osteosarcoma has a better prognosis than secondary osteosarcoma. Okay, now let's discuss Ewing sarcoma. With regards to Ewing sarcoma, we'll be discussing general features, diagnosis, and management. So let's begin with some general features. Ewing sarcoma is common in white males less than 15 years of age. It's a neuroectodermal tumor. Ewing sarcoma is located in the diaphysis of long bones, most commonly the femur. However, it can also be located in the pelvic flat bones. Let's talk about the diagnosis. A bone X-ray usually shows an onion skin periosteal reaction, which is reactive concentric periosteal hyperplasia. A biopsy of the mass will show anaplastic small blue cells. We should also perform cytogenetic testing for an 1122 translocation. This translocation creates EWS-FLI1 fusion protein. This translocation is important to differentiate Ewing sarcoma from a condition with a similar morphology like lymphoma and chronic osteomyelitis. Here we have an X-ray image showing an onion skin periosteal reaction. Here is a biopsy image showing anaplastic blue cells. Finally, the management of Ewing sarcoma includes either surgery or chemotherapy, depending on the stage and the prognosis of the tumor. All right, let's wrap up with a final question. A 12-year-old boy is brought to the physician due to pain in his right thigh. He first noticed the pain 6 months ago, and it has progressively worsened. He cannot bear weight on his right leg while walking. His vital signs include a temperature of 38 degrees Celsius, a blood pressure of 125 over 75 millimeters of mercury, a heart rate of 91 beats per minute, and a respiratory rate of 15 breaths per minute. The physical exam shows focal tenderness on the right anterior thigh. An X-ray of the right lower extremity reveals a mass in the femoral diaphysis with a surrounding concentric periosteal reaction. Biopsy of the mass shows small blue cells. Which of the following is the best next step in the management of this patient? A. Cytogenetic analysis for a translocation between chromosomes 11 and 22. B. Amputation of the affected extremity. C. Chemotherapy. Or D. IV antibiotic therapy. All right, this patient presents with right thigh pain and tenderness, the inability to bear weight on the ipsilateral leg, and a low-grade fever. A fever is suggestive of a generalized inflammatory state and can be present in an infection as well as malignant conditions like Ewing sarcoma. An X-ray of the right lower extremity reveals a mass in the femoral diaphysis with a surrounding concentric periosteal reaction. This description likely suggests an onion skin periosteal reaction. A biopsy of the mass shows small blue cells. The differential diagnosis for this patient's condition is either Ewing sarcoma, lymphoma metastatic to the bone, or chronic osteomyelitis with lymphocytic infiltration. So the best next step in differentiating these conditions is to perform a cytogenetic analysis for a translocation between chromosomes 11 and 22. This translocation is present in Ewing sarcoma, but absent in lymphoma and chronic osteomyelitis. So the correct answer is A, cytogenetic analysis for a translocation between chromosomes 11 and 22. This is the slide that we discussed earlier in this lecture, reminding us of the diagnosis and treatment of Ewing sarcoma. Let's discuss why the other options are incorrect. Option B, amputation of the affected extremity, and option C, chemotherapy, are both incorrect because although they're commonly used in the management of patients with Ewing sarcoma, we first need to confirm that this patient truly has Ewing sarcoma. Option D, IV antibiotic therapy, is incorrect because although it's used in chronic osteomyelitis, we first need to find out the exact cause of the patient's condition. So again, the correct answer is A. And that concludes our lecture on osteosarcoma and Ewing sarcoma.